Hi there, how are you doing today?
I'm doing very well, thank you.
Glad to hear that. So, if you could for us, please just introduce yourself, give us your name, your title, a short bio about yourself, your credentials, and then state the title of the article you'll be talking about today.
Thank you. My name is Julie Kentz Elting. I'm an associate professor at Long Island University in Brooklyn, New York. I've been a nurse for almost 40 years, and my clinical focus has mostly been on maternal child nursing. I've been in nursing education since 2007, where I've also held administrative roles where we're preparing students for clinical and placing them at clinical sites. Professionally, I do consider myself an advocate for students and faculty, in particularly addressing policies and decisions, let's just say from authorities that are not supported by evidence or logic. And that kind of leads me here. My article is titled Breaking Barriers, Nursing Education in a Wheelchair.
Fantastic. So, could you briefly give us an overview of why nurses should read this article?
So this article details the nursing education experience of Andrea. She's a woman who has been using a wheelchair since she was 12 because of physical disability, but she wanted to be a nurse, and it outlines the challenges she faced and overcame to become an RN. So her advocacy and problem solving in the face of these barriers really should be an interest to nurses in all roles, because we all influence the nursing profession, including education. Some people not in education don't realize how much they influence nursing education. I always believe it's important that you have rules, you have procedures. We need to know how to behave, particularly in nursing. You don't want people just doing whatever they feel like doing. But sometimes when we get stuck in our thinking, we can't think other ways. And this article offers an opportunity for people to kind of get unstuck in their thinking about the topic of educating people with physical disabilities to be nurses.
Well, obviously, it's a very important topic with disabled people wanting to become nurses. So, what made you specifically want to write a topic about something like this?
So I teach an undergraduate research and evidence-based practice class, and I always ask my students, if you have a research interest, come and talk to me and see if we can do a project. So in 2018, one of my students, Elena Abbott, was interested in a project about the barriers faced by people with physical disabilities who want to be nurses. At the time, she shared Andrea's social media information about how Andrea had completed her nursing program and become an RN while someone who uses a wheelchair. So we used that as part of our research project we did. So for the research, we created a survey from the outcomes for nursing students that are set by the American Association of Colleges of Nursing. And we collected data from over 100 nursing faculty across the US and asked them, do you think a person in a wheelchair could achieve these outcomes? So of course, Andrea was the motivation for asking that question. Those results were published in 2021. It was pretty exciting, but they showed that faculty had very few hesitations that someone in a wheelchair could reach the knowledge outcomes, could reach the affective, approach to nursing outcomes, but there was significant disagreement whether someone in a wheelchair could gain the necessary motor skills to be a nurse or have those psychomotor skills. Since the very beginning, when I heard about Andrea, I wanted to get her educational journey documented in the nursing literature. I think it's so important that people know this story. So the interview was conducted in 2021, and there were many roadblocks to getting this published based on what editors think is important. And I'm very thankful to American Nurse for recognizing the value of this article and getting it into the literature.
Of course, and it's such an important topic, as I mentioned before. And obviously, there's a lot of information that'll probably be needed to be retained by the people reading this article. But, people usually want to latch on to 2 to 3 things specifically when they read something that they can go back and remember. If you wanted people to remember or take away 2 to 3 things specifically, what would those things be?
So to me, I guess as nurses, understanding that we really do have a lot of power and influence over our profession. Sometimes it doesn't feel like that, but we do. And when we do things the same way, those rules and policies, they provide order for us. But the importance of this article, the takeaway that I want people to have is we need to look beyond that, and we haven't been doing a very good job. And I want to highlight this by saying when we did our research debriefing, with the participants, I said, imagine that I am a smart, talented ICU nurse, all right? Then I was in an accident, and due to my injury, I would use a wheelchair the rest of my life. Can I still be a nurse? And everyone reacted immediately like, oh, of course you can still be a nurse. Like it was some kind of crazy question I was asking. And they gave numerous examples of how I could use my nursing abilities in a different way. So then I waited a beat and I asked, so why can't we educate a person in a wheelchair to be a nurse? And this look of realization across the room, I'll never forget that. So the major takeaway I want people to have is to understand that we need to educate passionate and academically prepared nurses or people to be future nurses. Education's job is not to decide what path they take, what job they choose. Our job is to educate people to that level where they make the choice for the path that they take, as Andrea did.
Awesome. Well, Julie, thank you so much for sitting down with us today to talk about your article. We really appreciate you writing it and submitting it for American Nurse.
Thank you. I'm so appreciative. I can't even tell you that this is out there now. So,
All right, have a great day.
you too. Thanks.